Hello, my name's Perry Parks. I'm a retired Chief Warrant Officer, CW4, from the United States Army. I spent 30 months flying helicopters in Vietnam, and then again 2 years in Iran teaching Iranian helicopter pilots desert and mountain tactics. I'm retired with 30 years service. I'm also disabled from PTSD and chronic pain from degenerative disc disease. When I retired in 2003 and was no longer being tested, someone told me that cannabis would provide relief for several of my ailments, especially the chronic pain. I was skeptical. I really didn't believe it could work. What I found was not only did it provide the pain relief, it enabled me to get rid of the sleeping pills, the Vioxx, the high-dose opiates, which masked the pain but did not cure it, and all the other medications have been supplanted now mostly by just cannabis. In Vietnam or in any war zone, it's mostly a time of insanity, and it's punctuated by those few times when we got together and passed the joint around in Vietnam. You'd see several different cigarettes glowing, and somehow the serenity that became, I guess, connected with the act of smoking and the cannabis itself provided relief that I didn't even realize what it was doing at the time. Since that, I've gone to several medical conferences. I've been to the Patients Out of Time 6th Clinical Conference, and I'll be going to Tucson this year. What I can tell you is this is a tremendous disservice to the veterans. To force feed them narcotics for their pain is wrong. It is so wrong. The VA now has a directive that protects cannabis use for patients. Michael Krawitz was instrumental in producing this. You can Google it on your phone, VA 2010-035. This federal agency recognizes 6 different conditions, including epilepsy, that cannabis treats. The problem is, it only works if your state has an approved program. We have 16 states in the District of Columbia now. All the other states do not recognize this directive. Further, and even more alarming and sad, is they don't even tell the veterans they have a directive like this. No one knows it. Please, if you want to help the veterans, get active with us. Help us pass the laws in the states that will enable us to use the medical cannabis and get off the narcotics. A New York Times article recently highlighted a veteran who died from the interaction of all the narcotics, not from overdoses, but interaction of the narcotics. If for no other reason, if I tell you that it makes me feel better, given the relative safety compared to all the other medicines, it's wrong to deny me this. I was fortunate to be part of 5 veterans chosen for a documentary called The Good Soldier. Later, Bill Moyers bought the rights to the story and reassembled it, and it actually was entered into long-form historical programming Emmy Awards. And it was not only nominated, it received an Emmy Award. The reason I tell you this is to encourage you, first of all, to watch The Good Soldier, but secondly, to let you know that on the award stage that day, the 3 veterans who were there are all subject to arrest for their use of cannabis. This is wrong. Even the Conference of Mayors, the U.S. Conference of Mayors, voted to make this medicine legal, to do everything we can to extract the soldiers from the criminal justice system. I urge you, join us in this effort. See us at nccpn.org, North Carolina Cannabis Patients Network, a nonprofit devoted to changing the law in North Carolina. nccpn.org. Thank you very much.